Good morning, everyone. Happy Monday. Another week, and you guys are getting really close to finals, so that's exciting. So I know a lot of you are thinking about how to study for finals, how to study for cumulative exams. So I just want to talk quickly about that. Somebody posted in the Thriving Nursing Students group, I think overnight while I was sleeping, and I woke up to the most amazing post ever. And somebody had asked, how do you study smarter, not necessarily study harder? And that is the best question that you could be asking yourselves right now as you're heading into studying for your finals. So I wanted to point out some of the advice that you guys were giving and give it my A+, huge endorsement. So there were so many great comments, you guys, so if I don't mention yours, it doesn't mean I didn't think it was amazing, but there were a few that really stood out and really resonated with me because they really aligned with how I learn and how I study. That doesn't mean that the other methods won't work for you. So Kimberly, high five girl, Kimberly skims the material, okay, and then goes and does something else, which I absolutely love because nursing school has this way of taking over your life completely. And Kimberly gets up and does the laundry or unloads the dishwasher or whatever. And while she's doing this other thing and her body is active, her mind is thinking about what she just reviewed, and she's reciting the material to herself in her head or maybe even out loud, which I find really helpful. And then when that task is done, that little study session is done, she goes back and reviews her notes and compares what she was able to recite, talk through in her head against her notes, and basically, you know, grade herself on how well she was able to recall and process that information. So Kimberly, I thought that was fantastic. You said it was life-changing, and I think I could totally see how that would happen. So if you are the type of person who learns by talking things out, then you might want to try Kimberly's method, okay? So Kimberly, thank you for sharing that. And I also think that while you're moving around and doing something, you're staying active, and that helps you to stay engaged rather than just, say, sitting on the couch and trying to talk yourself through a concept. I would do this a lot while I was driving. I would use that study time while I was driving and even record voice memos of myself talking through a concept, and then go back and listen to it and look at it against your notes and see how well you're able to recall that information. That's fantastic, Kimberly. Thank you. Cassandra also had a really great method that she wanted to point out, really great tip. And she says, clue in, you guys, to when your instructor says something multiple times, that's a huge, huge, huge hint that that information is going to be on the exams, that it's going to be information that you absolutely need to know. So definitely, if your instructor tells you, you know, 5 times that phenytoin causes gingival hyperplasia, guess what? They're probably writing an exam question about that gingival hyperplasia side effect. So listen to your instructors and clue in when they repeat things. Very good tip. Lisa utilizes the NCLEX questions at the end of her chapters in her textbook. So she hasn't even had to go buy an NCLEX prep book on top of the book she's already purchased. She uses those questions. She says they're pretty challenging. She does those questions and then reads the rationales. You guys, I talk about this all the time. When you're doing your NCLEX style practice questions, even if you get the answer right, you're not done. You're gonna go back, you're gonna read the rationales for why that right answer was correct, because I guarantee you 9 times out of 10, you're going to learn something more by reading that rationale. Or maybe you just got lucky and you got the right answer, but for the wrong reason. So go back and read the rationales for why the right answers are right and why all the wrong answers are wrong, okay? So thank you, Lisa, for reminding us that there are often NCLEX questions in the back of the textbook chapters. Very good. And then Lisa also, so she was an additional tip on top of this was that she was getting together virtually with some classmates and doing the questions as a group. So if you do that, the idea would be do it as a group, talk through the questions, talk through the rationales, talk through the answers, reason things out together, teach each other, help each other, coach each other, and then look at the answer. Did you get it right? And then read the rationales and discuss those. That's a great way to solidify information as well and help pull each other over the finish line. I know a lot of you guys are having a bit of a struggle right now because it's near the end of the semester. You might have been doing all online classes or mostly online classes. You're burned out, you're tired, you're exhausted, you don't know how you're gonna get over the finish line. Get your group, get your core group. We talked about this, did I talk about this last week? I can't remember, I talked about it recently, I feel like. Get a core group of people together that you can count on and pull each other over the finish line, okay? You're so, so close. Okay, the next one that I wanted to talk about real quick was Jenny pointing out that you should focus your study guide, your note-taking, your studying on what the instructor put into the lecture, into their PowerPoint presentation or whatever. Most of the time, that's going to be where the exam is. Not always. I mean, I had a mental health instructor who focused heavily on the book. So I would not have been able to succeed in that class if I didn't really read the textbook in great detail. But a lot of times with a class like Med Surg, a class like OB, a class like Peds, there is a mountain of information. They're gonna focus in on what you really need to know, and that is what is on the lecture. So use that lecture, that PowerPoint, whatever that guide is, as your main study. And then if there's something you don't understand, that's when I would dive into the textbook and get more information, get a more in-depth understanding. A lot of times, as Jenny points out, the book is going to go into really deep detail or talk about things that you may not necessarily need. So really focusing on those key things from the lecture. Okay, excellent, excellent, excellent. Okay, you guys, if you haven't seen that thread, go and check it out. You're sharing such great tips. I love it. So I forget the name of the person, and I'm so sorry, who originally asked it. Excellent question. Thank you so much for doing that. Okay, so Laura asked about pharmacology. She's making med cards, and she's feeling like, what do I put on these med cards, right? Because there's a lot of information that you can put on them. So you guys know, if you've been listening to my podcast, visiting my website for any length of time, you know I like systems. I like step-by-step. I like things to be organized. So when I'm looking at pharmacology, I have a little framework that I use that really helps me focus on what the must-know information is. So if you want to hear this in action, I will link to a podcast episode where I use it. I believe, what was the last drug I talked about on the pod? I know phenytoin was one. That's why I thought of it earlier. So you can go back and listen to the phenytoin one. I did one on Haldol. I've done Nitroglycerin, albuterol, a whole bunch of them. But anyway, so what it is it's an acronym, drugs, D-R-R-U-G-S. So there's 2 R's. So D is for the drug class. You have to know the drug class. A lot of times, drugs will have 2 classes. They'll have their therapeutic class and their pharmacologic class. I find that the pharmacologic class is the key information that you really want to know. For instance, is it a beta blocker? Is it a calcium channel blocker? Is it an adrenergic receptor blocker? Like, what is it? So if you know the drug class and you've learned drug classes and you understand the concept behind them, that right there, if all you know that is that metoprolol is a beta blocker, you know about 90% of the things you need to know about metoprolol in order to give it safely and understand why your patient is getting it. So really know that drug class. Sometimes meds don't have a pharmacologic class listed. They will just have their therapeutic class listed. Like, for example, Precedex, dexmedetomidine is listed as a sedative and a hypnotic. It doesn't have a pharmacologic class listed. So it can get a little bit confusing for students. If there's both, focusing on the pharmacologic class will help you the most. The therapeutic class tells you a lot about what it does and why your patient might be getting it, but it might not necessarily give you a lot of info on the mechanism of action and all of that. So that's the D, okay? So know the drug class, Laura, and anybody else with this question. And then I like to kind of have a feel for what the regular range of a safe dose is. Now, I don't agree that you should have to memorize the exact dose for Lasix, okay? But have an idea, okay? That way, if the order says you're gonna give 200 milligrams of Lasix, I hope your nurse brain has alarm bells ringing, okay? Or if the order asks you to give 200 milligrams of fentanyl, okay? Alarm bells, because fentanyl is dosed in micrograms. So like the dose range, like a general idea. For Lasix, it'd be like 20 to 40 milligrams. That's a common dose, okay? So know the general regular dose range. Some medications like Giapreza, which is a newer type of medication that we use in septic shock, is dosed in nanograms, okay? So just knowing like those things, those dose range things, okay? And then the second R is the routes. A lot of medications have more than one route. So for example, nitroglycerin, excellent example of this. You can give nitroglycerin as an IV infusion. You can give nitroglycerin as a paste that goes on the chest. You can give nitroglycerin as a spray, sublingual spray. You can give nitroglycerin as those little capsules that go under the tongue. You can give nitroglycerin as an extended release tablet. So there's a lot of different routes, formulations, all of that for some medications. So know what it comes in, okay? And then the uses. What is it used for? A lot of times that'll be covered in your drug class information, but I want you to know why your patient is getting it. A lot of times medications will be given for a little bit of a different reason. For example, a great one of this is like a drug like Elavil is for depression, right? But your patient might be getting it because they have chronic pain. So knowing why your patient is getting it is super key. And then the G in the acronym is for the guidelines. This is where I lump in all those things that are like safety factors, administration things, education. So for the metoprolol, for example, for that beta blocker, you're going to check the heart rate and the blood pressure before you give it, and you're probably going to have hold parameters that you're not giving it if the heart rate's below 60, you're not giving it if the systolic is below 90 or whatever the MD deems to be safe. So you know those guidelines. You might want to understand that the nitroglycerin capsules should not get warm. So don't store them in the glove box. Don't carry them in your shirt pocket. Like things like that. Things that are key for patient education and safe administration. And then for S is the side effects, the key ones. I know a lot of drugs will have 8 million side effects. Listen in on what your professors point out as you're doing your practice questions. The things that are asked about in the practice questions are going to be asked about over and over again. Like, for example, the phenytoin, right? The gingival hyperplasia, very important. Most of the time your antihypertensives, a test question is going to ask about orthostatic hypotension and safe mobilization of your patients and teaching them to stand up slowly. So things like that. Even though there's a lot of side effects, the more practice questions you can do, honing in on what your lecturers are talking about can help you key in on the ones that you need to know about, okay? And then I would just make note of any life-threatening ones, anaphylaxis, Stevens-Johnson syndrome, things like that. Okay, so that's how I organize pharmacology med cards in a nutshell. So Laura and anybody else who had that question, I hope that that helps you. And then I'll link to some podcast episodes where I use this and you can see it in action. And then I just want to remind you, if you haven't yet checked out the podcast for this past week, so it was last Thursday, it goes up every Thursday, we talked about morning routines and how beneficial they can be. So key part of my morning routine is my coffee, you guys. So what I talk about in that podcast is how a morning routine can set your day up with intention and success and way less chaos. So go check that out. I know right now is probably not the time that you might be designing a morning routine and implementing it, but as soon as you get over that hump for finals, I want you to start thinking about that. And we'll be talking about this more when I do my New Year's challenge. I did it last year, it was super fun. We'll be doing that here in the group for I think the first week of January, and every day I'm going to give you a challenge that you do that is focused on helping you be, you know, a thriving nursing student with a balanced life and lots of wellness things, okay? Okay, so what is coming up on the podcast? I want to give you guys a little bit of a heads up with this. So next episode is on this Thursday. It's on Tracheostomy Emergencies. So if you are working with tracheostomy patients and it terrifies you, you definitely want to listen to that episode. If you're going into advanced med surg or critical care clinical rotations next semester, you definitely want to listen to that and understand the things to look out for and what you're going to do. When you know what you're going to do about something, you have way less stress about it. After that, I'll talk about some nursing school supplies that will come in really handy for 2021. And then the following week, December 17th, for those of you that are starting nursing school, it's all about things that you can do before nursing school starts to get ready. And then on the 24th, you guys, this one's huge, how to prepare for pharmacology class, because y'all struggle with pharmacology. So I'm going to talk about things you can do over the break to review and get yourself ready and primed to kick butt in pharmacology, okay? So that is one you definitely want to check out on Christmas Eve, right? I know you're just going to be listening to my podcast on Christmas Eve. And then on New Year's Eve, the next week, I did an interview with my sister-in-law, Hannah, who works as a labor and delivery nurse. She's a 2-year nurse, so she's pretty new. And her pathway to getting into that dream job, because I know a lot of you have the same dream. And then in January, we're going to dive into a neuro case study for those of you that love case studies. And then the next one before the semester starts is how to tackle mental health nursing, which is another class that universally students struggle with. So I'm going to talk about why mental health is so challenging so that you can develop a plan to mitigate that and go in there strong. Hang on, somebody just asked a question. Are there any podcasts to prepare for psych clinicals? Jen, there is a really good one on taking care of patients with schizophrenia that you might find helpful. There's another one about helping patients through alcohol withdrawal, kind of from the standpoint of you're going to be taking care of these patients in the clinical setting, but you will also obviously encounter them in the psych hospital. So check that out. That might help you. I'll look back and see if there's more. I will tell you that my psych clinical rotation was really interesting. It was really sad. And I cried, not because I was sad, because I was terrified. So I did my psych mental health rotation. Where was it? It was just at an inpatient place, an inpatient facility that had kids, it had adults, it had critical care. So the first day or so, I forget how many weeks we were there, but the first bit we were just with the general adult population, a lot of depression, suicide attempts, severe anorexia, bulimia, you know, life-threatening in that way, anxiety disorder, you know, things like that. So they weren't the critically ill, but they needed to be in an inpatient setting. And listen to the mental health episode, Jen, that's coming up, how to prepare for mental health class. You'll get a lot of tips from mental health clinical as well, because I'm telling you, the interventions in mental health are so different than what you're going to have in your med surg class. Bye, honey. My husband just left. In that it's a lot of what you say, and it's a lot of how you keep the patient safe, keep yourself safe. But you know, like if a patient is crashing because they've had a pneumothorax, you're going to help set up for a chest tube, right? You're going to give them extra oxygen. They may need BVM. But you're going to anticipate an actual, like, tangible, hard science intervention. With mental health, a lot of the interventions are what I call like softer interventions. It's more communication. It's more helping them develop insight. It's more about that patient safety thing. So it's totally different. So in your mental health clinical rotation, you'll be talking a lot and observing, and it's just different. It's really interesting, but it's different. So I did a few days there, and then and it also gets you really comfortable talking about things that are kind of awkward, maybe, you know, just point blank asking someone, are you thinking about harming yourself right now? Seems like an odd question. It's obviously not something that you just ask somebody at a party, but you get really comfortable talking about things that, you know, might be uncomfortable for you. So it's really, really good in that way. And then my other component of that was in the kids section. Holy cow. That was the sad part. I mean, there's kids that are 7 that are trying to kill themselves by running into traffic. Like, it was horribly heartbreaking and just horribly sad. And then the other component of that was the intensive care unit, and that's where I cried, you guys. Like, I was so scared. They have these rooms, these takedown rooms, I think. I don't know if that's the official name, but that's what they're for. And there were these little locked rooms, padding everywhere, and if the patient was, you know, in crisis and was a threat to their own safety or anybody else's safety, they had a whole process for taking the patient down, which sounds kind of awful, but it was really focused on their safety, doing it in a safe manner. Usually it involved injecting an antipsychotic of some kind, like, you know, Haldol or Geodon or one of those, and, you know, keeping them in this safe room. So I walk into the intensive care unit with my friend, and it was just scary. I was just scared. I'm laughing now because I was just overwhelmed, and those feelings came out. So she took me into the little room there, and she hugged me, and she told me it was going to be okay, and we were going to be safe, and we knew what to do, and the staff was going to keep us safe. And then after that, I had a really kind of great time in the intensive care unit of the psych facility. I had a fabulous patient to work with. He was brilliant, beyond brilliant. He had severe, debilitating schizophrenia where he could not survive outside of this setting. He offered me a job as chief of staff, which I was very humbled and honored to be offered. And we talked about just his life, and he knew he had severe mental illness, and it was just, you know, helping him through his day. And how do you do that? And we played bingo. And, you know, it was just really interesting to see. Definitely way different than working with the adults kind of in the not so critical area, and then the kids. So it's totally different, but it's really interesting. So I hope that you enjoy it. Okay, you guys, I don't know that there were any other questions that came in. Let me just look. Okay, Jen's gonna check that out. Beautiful, beautiful. Podcast. Okay, we did that. Hi, Ashley, you're the best. So thank you for saying that. I don't think there were any other questions, just people saying hi. Okay, hi to everybody that came in and said hi. And I'm sorry I didn't say hi back, but I sometimes don't see the questions until after I stop rambling. So anyway, I hope that helps you guys, and I will see you back here next week. And check out the podcast. I'll link to some of those examples so that you can see them. And I hope that helps you. And again, if you are looking for really good study tips for studying smarter, especially as you're preparing for finals, there is an awesome thread going in the Thriving group right now that just is full of amazing knowledge. So thank you all. And Jennifer says, thank you for all you do to help us. You're so cute. Jennifer, you're sweet. Okay, you guys, have a great day. I will see you back here on next Monday. Okay, bye.